Some of the precautions and warnings from the FDA are um, relating to driving and operating machinery, so it can impair judgment, as we know, and also motor skills. So it's really unsafe to drive or operate heavy machinery while under the influence of Xanax. Um, and also combining alprazolam with alcohol or other substances, like we talked about earlier, pretty much depressants, can lead to dangerous interactions and increase the risk of adverse effects. And lastly, patients who have medical conditions like substance abuse, depression, or respiratory conditions should use alprazolam with caution and strictly under medical supervision. This is arguably the most important section of this PowerPoint, and we're going to talk a little bit about addiction and withdrawal with alprazolam. One of the most shocking statistics that I came up upon during my research for this is that 20.4 million Americans ages 12 and older have misused benzodiazepines. And its addictive potential has long been recognized since the 1980s at least. Um, and tolerance and cravings usually work because over time the individuals develop a tolerance to the drug and they require higher doses to get that same effect, that same calmness. And so when they don't have it, they're experiencing cravings. And behavioral changes, I've seen people with my own eyes become a totally different person when they become addicted to Xanax. So it can lead to changes in behavior, social withdrawing, and just neglecting responsibilities. So take a look at the photo on the left side of the slide for some more helpful and also kind of disheartening statistics about Xanax. When addicts abruptly stop using alprazolam, there are symptoms like rebound anxiety, insomnia, and tremors. So, tapering off the medication is absolutely necessary and should be done under medical supervision to minimize the symptoms as much as possible. And if you know someone who's experiencing withdrawal symptoms, you should push them to seek medical support for the appropriate management because this is a really tough thing to have to go through. Just to go over a few components that are pretty crucial for a successful recovery from an addiction to this drug, there are detoxification programs and behavioral therapy, so counseling to address the underlying causes of the addiction and hopefully develop healthy coping strategies. And then, of course, support networks, so participating in support groups and engaging with other people in the recovery community will help uplift and encourage people to take more accountability for their addiction. It would be wrong of me not to include a slide on supporting the families because they play a vital role in the recovery process. So, education, open communication, and professional interventions can support both the individual and their loved ones when dealing with the side effects and adverse conditions with this medication. So, just to wrap up, I thought it would be nice to give a summary of the key points that I covered in this presentation. So, while alprazolam provides effective relief for anxiety and panic disorders, as we've learned, it carries lots of huge risks. We've learned about the side effects, the dependence, and sometimes the addiction that comes with it. So, balancing the benefits and risks, making sure you know the benefits and risks are both necessary things when taking this medication. Also, safe usage guidelines are in place. You can find them on the FDA website or on the label of the drug. So we want to make sure that you're following the prescribed dosages and have medical supervision, and just adhering to safety precautions. And lastly, it's really important to address the patient's medical, psychological, and social aspects in their life before using alprazolam, um, just to make sure that it's the right approach for the individual. But yeah, thank you so much for listening, and I hope you learned something new. I know I did. Thanks.